Good afternoon, everyone. I hope you're all fine. My viewers, my subscribers, I greet you all. My name is Lugalede, and I hope what you're going to get from here is so good of you, and it is good for effective communication between you and I, between you and someone else. So today we're going to talk about diseases. Diseases in Kiswahili we call it magonjwa. When we come to magonjwa, we have very many different kinds of diseases. One is African. African is heart disease. We have donda. Donda is ulcers. Have glaucoma. That is glaucoma. Have homa ya manjano. That is yellow fever. Homa ya matumbo. That's typhoid. Then we have saratani, that's cancer, or you can call it cancer, but you check the spelling of the words. Sometimes I may pronounce the way it is in English, but the spelling is totally different. We have kichaa au wazimu, that is insanity. We have kichocho is bilharzia, kidonda, want. You have kifafa, epilepsy, yeah? You have kifua kikuu, tuberculosis. We have kikohozi, that is cough. That is kipindupindu, that's cholera. That is cholera. Then we have tumbo la kuhara, that's dysentery. We have kisonono, that's gonorrhea. Then we have mafua, that's cold. We have mozio, that's allergies. Surua, that's measles. We have tibakemikali, chemotherapy. Have umanyeto, that's hysteria. Then we have utapio mulo, that is kwashiariko or kwashako. So when we are trying to learn another language, we must make sure we have not the spelling and then the pronunciation. I hope we are all at par. For all these diseases, some of the words may sound a bit difficult, but when you go through and you practice reading and pronouncing, I'm sure you're going to get something very different and very special. Okay? Try to share it with your friends. Try to let people know of what is going on here, so as they can also get the knowledge they get from other people. Then when we come to ukimwi, that is AIDS. We have upungufu wa kinga mwilini. Pepo punda, that is tetanus. Have teke kuanga, that is chicken pox. Then we have ukoma, that is leprosy. Ugonjwa wa kupooza, that is paralysis. We have ugonjwa wa kupoza, yeah, that is it. We have kidolo tumbo, that is appendix. This word is kind of hard, but I guess you know it in English. Then we have funga choo, that is constipation. Have maradhi, other diseases. We have najisi, that's rape. We have zumia, that is fainting. We have kiungulia, that is heartburn. We have kifanduro, that is whooping cough. Then we have kifaduro, kiharusi, that is polio. Have baridi yabisi. We have kuimkia, that is bloodletting. Have perema, that is mumps. Oh, wow. Then we have kupooza, that is paralysis. We have mateke. Oh God. Then we have ngiri, hamia, leukemia, anemia, goiter, matende, elephantiasis. Some words, they are the same in pronunciation as in English. Take for example, anemia, leukemia. Yes, So you need to take note of these spellings very well. The spelling might not look the same, but the pronunciation is the same. All the pronunciation may look the same and the spelling is different. Take note of the things. Then when we come down, we have mbulanga, skin disease causing discoloration. We have pumu, asthma. We have shinikizo damu, hypertension. We have vidonda tumbo, stomach ulcers. I'm sure most of us, we have ever heard about these diseases. Some may even say them in Kiswahili, mostly when you're in different countries, but you don't know what the person is trying to mean. But here it is. It's a way of learning Kiswahili. Just within a week, if you're very attentive, you've already gotten some of the things, and you can be able to construct a sentence. When we come to extra vocabulary, what do I mean by extra vocabulary? These are the words that are involved in diseases but not taken so much serious. Or these are the words that we use while we are constructing sentences, or when we want to measure, or when we want to know. I mean, some things they use in the hospital, the x-rays, a lot of things. Take a look and see. We have maumivu, that is pain, or hurt. We have kufa, to die. We have tembe, pill. We have kupima, to measure. We have kukinga, that is to prevent. We have daktari, that's a doctor. Daktari wa meno, that's a dentist. We have daktari wa macho, that's an optician. We have pata kitanda, to be admitted. We have kitibiwa, that is to be treated. Pata nafuu, to get better, that is pata nafuu pona, get better. We have ugonjwa, that is illness or sickness. We have gani, which usijali, do not worry. Usijali utapona, do not worry, you will recover. Then we have kwa nini, why, kwa sababu, because, neli, tube or pipe. Then we have bilauri, that's a glass. Hospitali, that's a hospital. Zahanati, clinic or dispensary. Then we have mukunga, that's a midwife. Nurse or mwaguzi, that's a nurse. We have kipima joto, that's thermometer. Then we have koleo, that's a scalpel. A scalpel, yeah. Then we have uyoka, that's an x-ray. Plaster, bandage, have chandarawa, that's a net. Have machela, stretcher. We have madogoro, that's a mattress. We have mito, those are pillows. Did you understand all this? We are switching to the sentence construction. Sentence construction, we are always having this part of the zingatia, which is not. Like there are some words you should not while you're going to construct sentences. We have kwenda kwa daktari, go to the doctor. Kwenda hospitali, go to the hospital. Kunywa dawa, drink, take medicine. We have kuona daktari, see the doctor. We have kuumwa na tumbo, to be hurt in the stomach. We have kichwa mguu, that's head, stroke leg. Furaha, that's happy. Huzuni, that's sad. Nina furaha, I'm happy, Choka, tired. Nimechoka, I'm tired. Kulia, to cry. Pole sana, very sorry. Mimi ni mgonjwa, I am sick. When we come to question formation, of course we're going to be using the words that we were reading there up. So, and we involve the kind of disease that we're going to be using, that will help you to be able to construct a sentence. And then at the end of the day, you tell me this language is hard. Not really. So number one, we have unaumwa na ugonjwa gani? What disease are you suffering from? In fact, if you want to learn very fast, you can even go back, teach yourself how to construct some of the sentences. It can be very easy for you. Some people, by the learn from online. It doesn't need this physical learning. That's why we have technology. That's why digital technology has come. Everything's supposed to be learned online, and which is very, costly. I mean, it's not costly, yeah? So you can try your time. You can actually always time yourself. You say, at this time, I'm going to Luga Lady's channel. I want to be learning this and this. I want to see what she has uploaded. At the end of the day, you're going to find yourself